Well, the Zika virus has arrived. There are over 1,000 cases nationwide, and a fifth of those in Florida. More on this now from our Alex Redmond. Alex.
Thank you, Ray. As the numbers of Floridians with the Zika virus rise, there are many unanswered questions. Perhaps the most concerning are of how to stop transmission and prevent the symptoms, including the risk of bearing a child suffering microcephaly. The first travel-related case of the Zika virus has arrived on the Suncoast. The declaration of public health emergency now includes Charlotte County.
It's only a matter of time until one of those mosquitoes bites a person in the United States, in the continental United States, and transmits the Zika virus.
Dr. Kyle Garner of Gulf Coast Obstetrics and Gynecology says there's still so much that we don't know about the Zika virus and the transmission and how it affects pregnant women.
But one of the concerns is the potential partner transmission. If their partners travel to these endemic areas and are potentially exposed, there is a potential risk that the partner can then expose it to the woman.
The Florida Department of Health confirms the first Zika-related case of microcephaly in a child born in Florida whose mother had a travel-related case of Zika.
A mother who had exposure to Zika while in Haiti, and so upon arrival here gave birth to a child with microcephaly.
Infectious disease Dr. Vilma Vega says that it's not a question of if the Zika virus is going to affect us here in Sarasota and Manatee County, but of when.
The concern is obviously that somebody could get exposed to Zika somewhere else and then bring it into this country, and the possibility of a mosquito biting her in this area, certainly, then that mosquito can then transmit it to somebody else.
Dr. Vega was the only infectious disease doctor participating in a bipartisan congressional delegation meeting in June on the Zika virus outbreak in Florida.
We've got over $26 million that Governor Scott has allocated specifically to Florida for the prevention and as well as the surveillance of people with Zika.
In a written statement, Suncoast Congressman Vern Buchanan, who co-chaired the Florida delegation meeting on Zika virus, says his #1 concern is for the health and safety of pregnant women and children. Congress needs to pass a bill immediately that funds Zika research and prevention programs. The House of Representatives has voted to provide this funding. Now it's the Senate's turn.
The hopes are that within the next 2 years that we will have a vaccine. Unfortunately, it's not something that can be done very quickly.
The Florida Department of Health's website reports daily Zika updates. July 6th count the highest to date for one day at 11 new cases. Dr. Garner says prevention education information is paramount in reducing the risk of transmission.
Yes, if we start seeing a large number of patients acquiring Zika virus in the United States, we will eventually see a case of acquired microcephaly here in Florida.
Well, in a year from now, we're probably going to be dealing with some of these complications. You know, we've talked about economic burden on this country. Why have we asked for so much money to try and find preventative vaccine and as well as surveillance of these pregnant women?
Dr. Vega explains the cause for concern is not just medical, but also economic.
Because the cost of taking care of one of these neonates, these newborns, with an active disease, whether it be Guillain-Barré or whether it be some other neurological issue, such as microcephaly, this is millions, if not billions of dollars in care of even one child.
The numbers of newly reported Zika cases in Florida change daily, and the Department of Health is not disclosing counties where pregnant women who test positive for Zika live. They say for privacy reasons. And the best protection that we have is to be vigilant about getting rid of standing water, wearing protective clothing, and using insecticide-containing DEET. Ray.
Nice. Okay. Thank you, Alex. Nice job. Up next, we'll talk to the experts. Stay with us.